So if somebody goes to you and they're trying to avoid a knee replacement,
Yeah.
total knee,
Yep.
maybe they're told bone on bone. How are you treating the knee? You said you loved knees.
Yes, I love knee. So first of all, we're looking at how the ligaments and tendons have reacted, meaning when you have pain, stuff tightens up. That tightening up causes increased compression, and it turns off something called a muscle called your popliteus. Well, that's the muscle that locks and unlocks your knee when you're walking. Can you imagine if 10,000 steps a day, that's what the Surgeon General says is average people, 10,000 steps a day, instead of your knee actually bending the way it's supposed to, it stays locked and grinds. That's gonna wear down cartilage in knee really fast. So a lot of people, once I release that, and then we put them on the decompression to help open up, and it's just very gentle to get some stretch and exercise in there to get the pressure off of it. Now we can look at whether it's hyaluronic acid, PRP, stem cell, to end up adding padding in there. As that padding gets in there,
You can actually grow the padding.
we actually add the padding, and guess what happens when you have padding? Then the cartilage doesn't get ground down anymore.
Okay.
So now if you have cartilage that's not being attacked by inflammation, it does its natural thing, which is divide and grow. So it's really interesting how you end up seeing that. Yes, some of the tissue we put in there possibly does become the new cartilage, but a lot of it is that you're adding padding so your body can do what it was normally doing, which was growing cartilage anyway.
Do you have people that were told you need a knee replacement and they went through your program and they don't need it all?
And they don't need it, yeah.
Really?
Because you can only get two knee replacements in a lifetime. Now, technology might get better someday, but right now, 2. So if you had to get one at 50, do you want one at 75? Do you really want to get cut open? So I tell people, listen, I don't have to be the anti-surgeon guy. I'm not the anti-surgeon guy. I'm like, hey, what if what we can do can cause that person to have no pain in their knee, they're getting along, and they might only need one knee surgery ever. Maybe one.
So you're like regenerating the area?
That's what the technique is called. Yeah, we're doing regenerative. It's called regenerative medicine, but it's just so hard to say what that is. The body is regenerating. Our job is to get rid of all the stuff that stops your body from living its normal life.
Now, what about arthritis though?
Arthritis, now the one we treat, the one we go after is osteoarthritis.
Okay.
Right? Osteoarthritis means the bone itself is having damage and it's breaking down and being inflamed. And I look at it from an idea of vascularity, meaning that bone and that cartilage cannot get enough nutrition, oxygen, water, and fluid to be able to keep itself healthy. Why? Millions of reasons. It could be wear and tear, genetic, could be what, but what's fundamentally happening is not enough nutrition in there. So that means we treat it very much nutrition based. We use the laser to improve how fast and how well the metabolism and the actual cellular matrix is going. And then, you know what, if we do need to talk to the physician about PRP and he looks at it and sees it's applicable, put some blood, put some healing factors in there. It's the person's own, their own body. Okay. And again, I mean, you're gonna start feeling like I'm a broken record because it's like ask a farmer to grow a plant. Well, I'm gonna get fertilizer, I'm gonna put it to the dirt, and then I'm gonna make sure the sunlight's on it and water it. And you go, what about this plant? Same thing. What about this plant? And so that's why I think our health system, these people can get better. Because it's
Do you have people with these osteoarthritis?
They get better.
And now they're fine?
Yeah, they're running races. The LA Marathon, I think, happened a few months ago, right? They're running. The sad thing is how few people are getting in to get this kind of therapy.
Is it they just don't believe it?
I think half don't
because
believe
look, it's cash. This is a cash business.
I'm gonna, you know me, I don't like to be controversial. Their doctors are telling them not to believe it because their doctors are doing insurance-based care and they don't know what's happening. They don't know the technology that's out there. But I promise you, if you're the doctor of the LA Rams or some the Denver Nuggets, you know this. They're using this in these professional sports. They're using this on these. You think
I had a doctor
$100 million baseball players?
Look, I think these are honest doctors. Okay.
Yeah.
The orthopedic, they're honest. But here's the thing.
Yep.
And I had this explained to me by a doctor sitting where you are. That if they don't see it, that means if they don't see stem cells working in their own practice, they don't believe it. Possibly.
Yeah.
But you see it all the time.
I see it all the time, and I invite them. Actually, I send out letters all the time to have them come to the office. Because obviously I would like to help their patients get out of pain. If they don't see it, Randy, I don't know what else to do except for they can read in the journals. So you know what? These docs, they're in a really hard position. They know about it, but for their patients, if the insurance doesn't cover it, they're like, I don't want to do it. So they're limited. But for their own family and for what they take their kids and their wife to, oh yeah, they're totally in the know.
They're going to do the stem cells.
They're going to do the stem cells.
And
Yeah.
look, I mean, there's certain people that goes, Randy, I'm not in, I would love to do regenerative medicine or stem cells, but insurance doesn't cover it. And my patient base will not pay $1 out of their pocket other than their copay or whatever.
Yeah, it's a hard road to hold because they're trying, but they can only offer what insurance is covering. So, it becomes, the patient's going to have to decide, do I want my body or do I want...
But all of these new cutting edge therapies, for the most part, insurance isn't looking at it yet.
It's not
right?
looking at it yet.
But it's
getting in
affordable.
there.
I mean, we've talked about this.
We've been able to make it affordable. You know what? Here's the thing. Someone could do a full, think they need a full knee replacement, come in and do treatment with us and be paying $250 a month. We do payment plans.